I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. What is a private patient advocate, and do you need one? I talked to Dr. Elena Borrelli, who is a doctor of medical science and a board-certified patient advocate. She helps people and families with their healthcare journey, and she practices in Shelby Township right here in Michigan. She manages their healthcare as she tries to help people live their healthiest lives, and she focuses on people that are diagnosed with cancer and rare disorders. She has worked in healthcare for over 20 years, and apart from her experience in professional practice, she has encountered frustration, discrepancies while personally navigating the healthcare system. She has been the provider, the patient, the daughter, the sister, and the parent facing the overwhelming healthcare system and left feeling alone and confused. Her passion is to help patients navigate the chaotic healthcare system that no one should have to do alone. And getting a second opinion is often a good idea, or enrolling in a clinical trial. Dr. Borelli's research best management options for undiagnosed or chronic disease patients, as well as related insurance and billing issues, which we can all, of course, relate to that. She can also assist if you're admitted to the hospital or you are in a rehab facility, and she communicates with the healthcare team and helps reduce medical errors as well through her work. So a lot to talk with her about. Dr. Elena Borrelli, thank you so much for talking with us about private patient advocacy. The first thing I wanted to do is have you explain to us kind of how you got where you are today.
Sure. Thank you for having me on today. It's a pleasure. So I have worked in healthcare for over 25 years, and I've worked as a healthcare provider. I was a PA for the past about 15 years. And throughout working in the healthcare system, I did notice that there was a lot of challenges and issues with the system overall. And I used to think like, okay, one day I'm going to create some type of business where I'm able to just work independently with patients and just work one-on-one with them, not have these constraints that I have in different positions as far as limitations to what care we can provide based on maybe the system's coverage or what is medication that's on formulary or what our protocol is and things like that. I'm not going to be contained to just having a certain time limit, like, okay, you have 20 minutes with the patient or half hour with the patient, then you're going to move on and things like that. Because I saw so many issues in every situation where the patient was not being given the best care that they could or the best resources and things like that. And despite having this huge team of different healthcare professionals, they were still not really getting what they ultimately wanted. And so as I continued to work, I kept seeing these issues come up. I kept thinking about this idea that I had. And then I actually experienced it from the other side. So my son became critically ill when he was 2 years old and was in and out of the hospital trying to navigate it from the parent side. My brother and my father both got diagnosed with stage 4 cancer. It was very eye-opening to see it from the other side, because I was like, wow, there's an even bigger issue than I really thought. And so when I started looking into this, I realized this is actually a profession. It's not my idea. I just didn't know about it. It actually exists in other parts of the country and things like that. And that's really how I got into patient advocacy.
Tell us, because you don't deal specifically with cystic fibrosis, but it's so important what you are doing, because not everyone has the training or the ability to advocate for themselves or for their child. This is something we learn. This is something we've become experts with. Do you want to share about how your son is and how he's doing?
Oh, sure, for sure. My son is now 7. And at the time, I wasn't a certified patient advocate, but I was a healthcare professional. and a healthcare provider. So I did have a lot of knowledge of his condition and all of that. However, when you are the patient or the family member, especially the parent, it's different because you are emotionally invested. You're emotionally trying to manage and run everything. So it's not really fair to you to be the main advocate. I think definitely as a parent or as a patient, you have to be your own advocate. But there's too many things to juggle at once. And it's easy for things to get clouded because you have high emotions with it all going on. Plus, you're exhausted physically, mentally, pretty much everything. And I think, too, when it's not yourself and it's a loved one, especially your child, it's even double because, especially when they're small, you don't really know exactly. They can communicate. There's an issue with communicating 100%, things like that. And so for me, it was a big struggle. And I realized, I wish I had a patient advocate at that time. I didn't really know they existed at that time. And it was very challenging. A lot of his diagnosis and treatment were delayed. And thankfully, I was able to really push and insist. And despite what answers you were being told, I'm like, no, this doesn't seem right to me. I want to progress and move forward and get second opinions, get third opinions, get fourth opinions. And thankfully, today, he is actually doing very well. Just a brief summary for him, just after he's turned 2, all of a sudden, he came to me and told me that his leg hurts. He didn't have an injury or anything. And then about 2 hours later, he was limping and he couldn't walk. And then he was crawling. And I was like, what is going on? He had a little fever. I had given him some medicine and his pain just kept progressing. He couldn't stand. And this was, very typical from what he normally did. I went to his pediatrician and they were like, it's probably just a virus. I'm like, it's pretty extensive to be like viral aches and stuff. Just to check it out, why don't we do an X-ray? So he did an X-ray. The X-ray looks okay. And they were like, oh, just keep watching him. And he's spiking 103, 105 fevers despite medication nonstop that I'm alternating. And he'd be waking up, he still can't walk. And he'd be waking up crying in pain in the middle of the night. I'm like, this is not, something's wrong, right? So I took him to the ER and I was like, something's going on with him. I don't know if he has an infection or what. This is what I'm thinking. However, it was difficult because when they did his labs, they all looked okay. And so it was very strange because they're like, if he had an infection, his lab would be elevated. But I was like, okay, understandable, but why can't he walk? And they're like, we don't know. So they were like, it's your choice. I know you want imaging, like an MRI. Typically, he doesn't warrant this, but since he's not walking, if you want it, we'll do it. And I was like, yeah, I want it. Of course, nobody wants to, as a child, if you have an MRI or something, you have to put your child under general anesthesia. So do I want that? No. But if it's the determination of figuring out what's wrong with him, you have to weigh your options. So I was really for the MRI. They did the MRI. And then as soon as they brought him back to me from the post-operative, they rushed back in and told me they had to rush him to surgery because he had a crazy infection in the surgery. He had pus pouring out of his hip. He ended up having a septic joint, which then led to, he had osteomyelitis of the whole leg. And then in addition to that, his infection, it was just a delayed atypical thing. He ended up having repeated surgeries. They couldn't figure out why the infection wasn't getting better. We had to go to all these different specialists, transferred to different hospitals. So to kind of summarize, over the following 3 years, we were in and out of hospitals, trying different modalities and things like that. He had to learn how to rewalk, therapy, all of this stuff. As a result, he does have avascular necrosis. So his femur is half the size of the other femur. But through all of this, we were told he'd never be able to play a sport again. He'd never be able to possibly put weight on his foot. And now if you look at him, he's playing sports, he's running, he's very active. You wouldn't even know that there was any issues if you talked to him or watched him play. He's not completely healed, but he's living a great quality of life.
How long did it take to get that diagnosis?
So the first one, I would say, just to actually get him to get the MRI and stuff, it was a good week because I would kept pushing. And the doctor was like, oh, just wait another day. Oh, just wait another day. And I'm thinking, I'm not waiting any more days. You get to the ER and they're like, his labs are okay. Sure enough, after they did his MRI, they reused his labs and they were through the roof. So I always think there's algorithms in medicine for reasoning. However, you have to sometimes think out of the box. A lot of times you have to think out of the box. You have to look at the whole picture. And I think a parent's instinct is so important because you are with that patient or child all the time. They're normal and they're not normal. And you know that better than anyone else. So when a parent is voicing that to a healthcare provider, they really have to take it seriously, not just, oh, you're a new mother, oh, you're over paranoid. It's really important because you're getting advice to help and information that's really going to help you lead to the right diagnosis.
And how scary if they had not listened to you or asked you about the MRI. I'm sure you don't even want to think about what.
I could have died for sure. It was and it's hard because like, even at the time, my husband at the time was like, they know what's best. A lot of people don't want to like question or second guess providers because it's like, they know their job, do their job. But in the same sense, it's my child, right? So they don't know my child. I know my child. There's no harm in asking questions. And I tell my clients that all the time. If you have a question, ask it. Your opinion is important. You are working with your healthcare provider. So you need to like share how you feel. You need to feel comfortable in these conversations. It's not just they tell you what they think and you do it and you can't ask questions. Maybe a long time ago, that was kind of how healthcare was set up, but it's evolved significantly since then, thankfully.
I think we all have some sort of diagnosis story, right?
Mm-hmm.
Did you feel once you finally got the answer and you knew what was going on, is that when it hit you that this is what you should do, or were you still figuring it out?
I still didn't know that this was a thing at that point, like an actual already created job, right? I definitely was heightened, like, okay, this is maybe like the time where I actually need to do something, because I didn't realize that when it actually happens to you, you have a different experience and view on it. But it was such a like, it was like never ending. Like there were so many errors and things that would happen. So then we got transferred, and then I kept like, hey, he's not getting better. You told me he was going to walk, but like 2 days later, and he's now having fever still. You're giving him antibiotics, like IV, and he's still in pain. Like something's wrong. Does he have to go back? And they're like, oh, we don't know. We can just watch him. It was always like, let's just wait. Let's just wait. Let's just wait. And so then I had to push again, and like same thing happened. Then they took him in an MRI, and then they had to rush him to surgery again. And it was like over the years with him, I was always having to review things, double check them. They'd order the wrong testing and things like that. And the majority of his healthcare team were great. And it's just the system. With any situation, there's so much room for errors because there's so many people involved. Everything is so high, fast paced, and there's so many things going on. It's very common for things to go not perfect. And this is what I deal with every day with my clients. And that's why I like being that additional team member that is able to spend a little bit more time reviewing and things like that to help prevent situations like this.
Is it even harder if you're in the medical profession because you know so much, do you think?
When it happens to me, yes. I actually have tons of clients that are doctors, nurses. A lot of times people would, like in the past, I don't get it as much now, but like, oh, I'm a nurse, so I don't need a patient advocate, or I'm a doctor, I don't need a patient advocate. But I actually have quite a few of those clients now because, first of all, you shouldn't have to do it all alone. You want to be able to be there emotionally and go through it with either yourself or your family member. But the other thing is me already knowing that all these issues could arise, I'm more attentive, of course. So it makes me more nervous of what's going to go wrong in a personal situation. But I think, or I know that because of my medical background and my experience, it does give me a huge advantage of being a private patient advocate because I know what I'm looking for. I know I understand disease processes. I know the system and how it's supposed to work. And so it helps me identify and pick out gaps more and things like that.
And so how does it work? And I'll ask you with a question too. Yeah. So I was having a non-cystic fibrosis situation with my mom, not my daughters. And we thought she's 86. So last year when she was 85, I'm just wondering, like, what kind of things do you do? So
sure.
We thought she had a stroke. She was a little bit disoriented, and I wanted to stay the night at the hospital. They kicked me out. Long story. 5 security guards came to escort me out. And I just laughed, and I was like, go wait in the hall. I'll say goodbye. But I needed to be there for my mother because no one else could be there, right. And I wanted to stay. So in that situation, and I think going forward, I don't want to be in that situation again. Mm-hmm. So are you helping people with all kinds of different things?
That's a great example. And I've been in that scenario many times, actually. When I am involved prior to things like that, then we have a very systematic plan and communication where that would be prevented. For example, for my clients that I have regularly, If they go into the hospital, I am already on their care team. So I'm talking to the providers, the nurses, the care team. So they know the plan. Like, hey, so-and-so is going to stay with her tonight. We have it all planned out. If there's ever an issue, then they would call me and I would make sure it was not an issue where you were being escorted out and things like that. However, sometimes I'm called in the midst of it. Like, hey, we have this problem. I want to stay with my mom. They're not letting me. Can you help me type of thing? And in that case, then yeah, it's more of a jump in, fix a problem, and then kind of figure out how we can prevent it in the future. But I did have a very similar situation about 3 weeks ago where there was a client that had stage 4 cancer and his wife had went home to get some clothes to come back to sleep. The hospital was full. And so they had him on a different, like a floor. So it wasn't like the typical oncology floor. The shifts had changed. During the day, I was actually there and everyone kind of knew the plan. The shifts had changed for night. And the new head nurse was like, oh, your wife can't come in. That's our policy. And so they wouldn't let her up. And the patient was very upset saying like, what do you mean? I never stay by myself at night. Like, and they're like, too bad, you can't come in. It started to be a big issue. So at that point, the patient called me. I spoke to the house manager, contacted them, and it all got straightened out. And the wife was able to come back in. But it happens a lot. And unfortunately, as the patient or the family member, you don't know the policies. But even if that is a policy, hospitals are there to comfort and do the best interests of the patient. So there's always exceptions that can be made. And it really should be on an individualized basis. A lot of times in those situations, you're running into one person that doesn't really either is on a power trip, doesn't care, or it's just a break in the system. But you just have to know, who do I go to next? How do I get to that chain of command quickly so that it's actually going to be able to fix the problem in that situation if it's after hours and it's not like your typical availabilities.
And for you, so how do people get a hold of you? And I imagine some people get a hold of you when things are calm and they're like, I've got this disease now or situation and I need a private patient advocate, or they're in the midst of the trauma, right? So
the preferred would be before, obviously, but a lot of times people don't even know what a private patient advocate is until you need one, right? That doesn't always happen. And so I will say we are referred a lot through like different organizations. Some hospitals will actually refer, like case managers and things will refer us to us. We get a lot of referrals by word of mouth for sure. Also, we'll get referrals through GNA, which is a great organization. And so really it just depends. We can help and step in any point of it. Preventatively is preferred because the majority of my clients, we can help in various situations, but the majority of them are rare disorders or undiagnosed. And a lot of that is also cancer as far as the rare disorders go. So they will come to me a lot of times saying like, hey, I have been to so many providers. I've been to so many specialists. Nobody can figure out what's wrong with me. I feel gaslighted, which happens a lot, unfortunately. What can you do for me? Can you help? But again, sometimes it's like, hey, I'm in the hospital. They want to discharge me again. And I'm not any better off than I was when I came in, type of thing.
Are you finding that as people become more aware of you and what you do, that you're getting more business?
Yes, we definitely are getting busier and we're continuing to grow because I think this is such a new area that, again, people know that it's not uncommon to know that the healthcare system is broken, right? There's so many issues. It's not an easy fix. And unfortunately, you can't avoid the healthcare system because when you're sick, you need to get help. And so now when people are hearing there's a way to get improved care, have assistance, I think it's huge. And once they hear about it, they continue to reach out. So a lot of our clients we have that are family members, our friends and things like that. And sometimes we'll have like the whole family because maybe they're not as sick, but they want to have someone there in case they do go to the hospital, in case you're sick. Or a lot of times we'll have like family that maybe their mother doesn't live nearby or they're busy working or whatever it is. And they want someone just to kind of help oversee the care, making sure she's getting the right medication and the right appointments and things like that. Or if she does go to the hospital, that she won't be by herself and things like that. So I really try to individualize the approach based on what's needed. So it's not cookie cutter at all because every person is different. So everyone has different needs, right?
And then how do you work legally if somebody is the power of attorney? Sure. Or how do those things work
We have very often situations like that. And so if we have someone that's a power of attorney, they provide us their power of attorney and we have them sign the agreement with us and all of that. And with our clients, we have a authorization agreement that we would provide to any provider, whoever we were talking to. So just which says that we are their patient advocate, so we can communicate and discuss with them on their behalf.
If you can give us some examples of how you've helped people, because just listening to it and thinking about how many times in these last 29 years with my daughters, and then my husband was hospitalized at one point, how exhausting it is for us when we're advocating. And as a mother or a spouse, you have to hold it together for everything. I just think, oh my gosh, if I had Elena, if I would have learned about you sooner. And I just think, what a gift, what a wonderful.
Thank you.
It would just be magnificent to have someone else who shares that burden with you.
Yeah. And honestly, for me, I really feel like I connect with everybody. We have a great relationship. It's very trusting and comforting. And I feel like I'm actually helping, which I love. I love that. And I also meet an amazing amount of people through this over the years. I've networked with so many phenomenal providers and different resources and things like that. With my clients being all over the US as well as in Canada, it really helps because a lot of my clients share similar rare disorders or rare symptoms and stuff like that. And it's really easier for me to connect them with specialists, maybe if they're not even locally, because I've helped them with other clients and things like that. And they will do maybe virtual visits in those situations. So I like also being able to reach out and get quick responses and maybe help streamline the process to getting a proper diagnosis or treatment and things like that too.
This was going to be my next question is, you don't help just people in Michigan because we have discovered we are neighbors. We're not far from each other. So you can help anybody. You don't have to be in their state.
Correct. As a patient advocate, I am not actually prescribing medication. So even though I am a doctor of medical science, I'm not working as their healthcare provider. I'm working as their patient advocate. So I'm able to advocate in all the states there, and as well as Canada.
What are maybe one or two of the stories that you're proudest about of someone that you were able to help?
Oh, there's so many. I feel like they're all so important in their own. I will say that when patients have been dealing with symptoms for so long and then they're undiagnosed and then we actually get to a diagnosis, I think that's always huge. I had a patient or a client that had a lot of different symptoms as far as like dysautonomia and neurological symptoms. And she had been to so many different specialists and they couldn't figure out what was wrong with her. Two tests kind of all came normal for the most part, or they just weren't piecing together. So over time, I typically like to review all of the records initially, medical records, and kind of look to see like, okay, what's been done? Where are there gaps and things like that? And so that's where we started. And then after some extra testing that was a little bit atypical, we were able to get some results and find a specialist that was able to actually diagnose her. And now she's doing so much better. That's just one example, but a lot of my clients have that kind of example. The other thing I think is huge is I have a lot of clients that have cancer, especially rare cancers. And so there was one client that had pancreatic cancer, for example, and he wasn't really getting the care locally. It wasn't working. So I was able to arrange a second opinion, and we were able to start a new treatment that wasn't really offered locally. And he went into remission and has been doing wonderful. There's a lot of good stories like that. A lot of times it sounds easy, but it's not the easiest journey. There's a lot of trial and errors and appointments and things like that. But I think when you have that visit that like you're so excited about and then it doesn't happen, but you go to the appointment and it's like the appointment's like 5 minutes long, you're left with no answers and it's like almost draining and you feel defeated. Like I'm there with them to be like, don't worry, we're going to try something else. There's another option and things like that. And also too, we really prepare for appointments. So we don't hopefully get those. A lot of times I will virtually attend. Occasionally, if they're local, I'll attend in person too. But a lot of times I'll virtually attend if they want me to too. So I'm there. And if I'm not, I will often be in collaboration with the provider or the team beforehand. So they kind of already know, like, this is kind of why we're coming, where we're at. We provide records and kind of a layout of what we were thinking and referrals and things like that. So you do get the most out of your appointments too. I think that's a huge example of how I help.
And I think it's really important because as a caregiver, when things happen to us, I also don't think we hear as well as we do when we're a caregiver. That happened to me. My husband was with me and my daughter was on the phone and I had to get a hysterectomy this year. And we were talking after the doctor visit and Emily said, "Mom, that's not what the doctor said." I'm like, "What do you mean? That's what I heard." She's like, "No, that's not what she said. She said this."
That's a good point. Very true. Yeah.
It was really helpful. What do you have to do to be certified as a private patient advocate?
You don't have to be a board certified patient advocate. I highly recommend it just because it gives you a level of kind of clearance and certification that you know what you're talking about, that you're vetted and credentialed. So that does require a test, an application and a test for that. I actually need to renew mine as well because it does require renewal. I think the important part of, just like you would go to see a credentialed specialist or board certified plastic surgeon or something like that, it's nice to have somebody that is board certified. I think that as a patient advocate as well, it's really important to see what experience that they have. Are they medically knowledgeable? Have they done this before? Have they had patients and clients similar to your situation? Or do they know how to navigate rare disorders and things like that? And so I always will share that with prospective clients. Like if they reach out to me, I always say, like, if you're looking into who you're going to choose for a patient advocate, you want to make sure that it's someone that's trusting and that you ask questions to make sure that they are knowledgeable, because there has been a significant increase in the last probably like year and a half of people popping up as starting patient advocacy, which I think is great. However, I think there has to be kind of an understanding that we're not all the same, right? We didn't all go to the 4 years college for this or 8-year college or whatever it is for this. So it's important to ask these questions to make sure that it's the right person for you.
And are you covered by insurance? How does that?
So currently we are not covered by insurance. Private patient advocacy is not. HSAs are often used, and a lot of times you can use your HSA. Sometimes they'll be reimbursed by certain employee plans and things like that. But there is a push to have more coverage moving forward. The benefit of a private patient advocate is that we are not biased, right? I'm not constrained by any healthcare provider or any insurance company, because that's another big question that I get asked. My health insurance company offers a complimentary patient advocate, or my hospital does, which is great. However, the difference in that, even though it's titled the same, it's not really the same. Those work more as like customer service representatives and so forth. And sometimes they are helpful in some situations to provide like resources to things, but they don't have the same background and experience as a private patient advocate. And in addition, they are constrained to wherever they're working, right? They have to work under that employer. So for instance, if they're working from a healthcare insurance company, they're not going to tell you to see somebody outside of their network or things like that. They're going to have to stay within there. Or if there's a bill that perhaps was not charged appropriately or a claim or things like that, they're going to be left to assist with that, where from a non-biased perspective, that's something that we could challenge and try to process.
And the way we met was I was on your podcast.
Yes.
Ask the Patient Advocate is the name of your podcast, and everything is in our show notes. And I just think you're terrific.
Oh, thank you. I think you're terrific too.
Thank you. And why did you decide to do that podcast? Did you find like it was helping people get answers?
So it's still, a lot of people don't know what a patient advocate is, right? And so we were getting a lot of the same kind of questions. And I just thought, like, actually, someone had said to me, like, why don't you start a podcast? And I was like, I don't know anything about it. That's not really what I'm looking for. And they're like, no, it'd be helpful. So I was like, okay, we can give it a try. And it's been really great. I've met a lot of great people. I've had a lot of great guests on. But I think it does help kind of give a little introduction to like, what is a patient advocate, and like make overall people feel more comfortable that it's okay to ask questions, and just seeing that they're not alone is my goal for that. And understanding like, hey, there's different resources out there. I talk about a lot, like it's definitely okay to get second and third opinions. It's okay to be comfortable to step out of your comfort area, I guess is a way to say it. But yeah, I've actually really enjoyed it, and we plan to continue with a lot more episodes.
Thank you so much for coming on this podcast.
Thank you.
I always like to ask people when we're ending if there is something that you wanted to say that I didn't ask you, anything that we didn't cover that is really important or that empowers you or excites you about being a private patient advocate?
I think we covered a lot of great things. I really just enjoy going through this journey with everyone. And I think it's such a great blessing to have this role to be able to do that and for people to trust me to go along with them. I really enjoy being able to help people. And I think they, enjoy having me along for the ride. And so I just feel like in stressful situations, challenging situations like the healthcare system and going through it all, it's very common to have times where you feel alone, abandoned, overwhelmed. And my goal as a private patient advocate is to help prevent that and to make the clients feel that they're not alone. There's somebody with them that believes them and is there and is able to talk to them whenever they need to. But I guess that's last comment.
It is wonderful. And thank you so much for doing this podcast with us and making us aware that there are advocates out there for people who need them. It's wonderful.
Thank you so much for having me. I really appreciate it.
The original music in this podcast is performed by Kevin Allen,
it's not complicated,
who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.